Nigeria. Till date, 153,187 cases have been confirmed. 120,943 cases have been discharged and 1,874 deaths have been recorded in 36 states of the Federation and the Federal Capital Territory, Abuja. The 521 new cases are reported from 21 states. Lagos has the highest with 170 cases, followed by Ogun State with 65 cases, and the Federal Capital Territory is third with 45 cases. 3 states with least reported cases are Ekiti, 6 cases, Niger, 5 cases, and Imo with 3 cases. The Presidential Task Force on COVID-19, under the chairmanship of Mr. Boss Mustafa, the Secretary to the Government of the Federation, has been coordinating the national response activities. The Multi-Sectoral National Emergency Operative Center has, as at Wednesday, 23rd of February 2021, activated Nigeria at level 3. What is level 3? What has been the effectiveness or otherwise of the NCDC's COVID-19 protocols? For now, Oxford AstraZeneca vaccine and 3 other types of vaccines have been discovered. What is their efficacy, availability, and are they affordable? When is Nigeria going to take delivery of any of the vaccines, and what are the strategy for distribution? These are the issues and more that will be central to our discussion with Dr. Chike Ehekwazu, the Director General, National Center for Disease Control, NCDC. Dr. Ehekwazu trained as an infectious disease epidemiologist and has more than 20 years experience working in several positions and several national public health institutes, including the South African National Institute for Communicable Diseases, the United Kingdom's Health Protection Agency, and Germany's Robert Koch Institute. Dr. Ehekwazu has led several short-term engagements for the World Health Organization, WHO, mainly in response to major infectious disease outbreaks around the world. Dr. Ehekwazu is a graduate of the College of Medicine, Nnamdi Azikiwe University in Nsukka, and has a master's degree in public health from Henry Kern University, Dusseldorf, Germany. Dr. Chike Ehekwazu, Director General, Nigeria Center for Disease Control, NCDC, welcome to platform.
Thank you, Mohammed. Great to be on your show.
As usual, we have our panelist, Ruth Aguele.
Thank you very much.
Dr. Ehekwazu, once again, thank you so much for coming, and we'll begin from that technical word, level 3. What does it mean?
Yes, thank you very much for having me. Activating our EOC, our Emergency Operations Center at level 3, really means that within the National Public Health Institute, the Nigerian Center for Disease Control, we have elevated the COVID response to our primary responsibility. It means that we have to have taken a difficult decision to deprioritize all other activities and focus primarily on COVID. We do this in exceptional circumstances. Really, this is the first time we're activating at that level in recognition of the pandemic. It means that some of the responses to the other infectious disease threats have reduced to some extent. But the great thing about this response is that it's not only a health sector response. So normally our outbreaks are led by NCDC within the Federal Ministry of Health. But like you said in your introduction, the impact of this pandemic is so, diverse across the Nigerian economy, our way of life, and different sectors that, Mr. President instituted a presidential task force to lead the response. So we lead the public health response, while the Presidential Task Force leads on the national response to this outbreak.
So I think the natural thing is to ask, how far so far with respect to the NCDC protocols? How effective do you think it has been?
You see, we're faced with a once-in-a-lifetime situation, a pandemic that has devastated countries around the world, of which we are just one, right? And we made very difficult decisions at the PTF level that we then had to implement the public health facing parts of it. We had to scale our testing capacity rapidly, scale our surveillance, infection prevention and control measures in hospitals, and all of that. But what has become popularly regarded as the NCDC protocols or guidelines are really our advice to people on what people can do themselves to prevent transmission of this virus from one person to the other. So we came up with a few guidelines in terms of wearing of masks, keeping 2 meters apart from each other like we are here in your studios, avoiding mass gatherings altogether, limiting mass gatherings, and all of these are so-called public health measures so that we prevent this transmission from one to the other. I think the effectiveness of that is really not just NCDC's role. It's really how, as a society, have we been able to do so. So to conclude on that thought, the countries that have been most successful in implementing, adhering to these, there have been two types of countries. Countries that have used force, where the state is very strong, or countries where there has been a strong social contract between people, citizens, and their government, right? In the beginning of this outbreak, you will remember, Mr. President made a very difficult decision to shut down parts of the economy for a while in order for us to prepare for the response. That was very effective in limiting transmission over the first few months. But eventually, you know, realizing our reality in Nigeria, our socio-economic reality, people had to earn a living. Mr. President decided to lift the lockdown, allow some aspects of life to continue, but then solicit the support of Nigerians. And that was when we started the campaign on asking people to take responsibility. And that's really when we, you know, liberalized this response and brought in citizens into the response and saying, listen, just don't do what government tells you to do. Do what you think is important for preserving your own life. And I think we've been fairly successful. The data shows that we haven't had as bad as an outbreak as many people predicted that we would have. In
spite of that, Lagos or FCT are leading. Why do you think that is?
You know, the reality of life in Lagos is clear to every Nigerian. You know, you have a very densely populated city, the fastest growing city in the world, probably, where has a big international airport. 60 to 70% of all international travel into the country comes into Lagos. And like we know, this virus came from outside. So a lot of those people who lived in Lagos led to transmission, and that has been sustained over time. So right now, Lagos still has a large burden of the infections in Nigeria. But I must also say, Lagos has had one of the most robust responses to this outbreak so far, you know, across all aspects of it. So there's been a very strong collaboration between the federal government, the government of Lagos State, and the people living in Lagos to limit transmission. I think at the beginning, if I think back to some of the conversations I had last year, you know, people really thought that people would be dropping on the streets in Lagos once that outbreak is it. And yes, we've had a tragic loss of lives, but to be honest, I don't think it's been as bad as people predicted, but we need to hold on to the very fragile gains that we've had so far.
And since we're talking about states, so far since the pandemic started in the country, I know NCDC has lent support, you know, in terms of strengthening capacity and preparedness for states.
Yeah.
Now, what were some of the impediments you encountered in these states if they have to respond, you know, effectively?
So thank you very much, Ruth. I think you know, at the state level, to be honest, many states historically haven't invested as much in health security and, you know, in public health generally. But I think that has changed a lot over the last year. Many state governments, I mentioned Lagos in the beginning, but there are really many others. You know, the Nigerian Governors Forum has a subgroup of governors with whom we meet at the Presidential Task Force every other week, led by His Excellency, the Governor of Delta State. You know, I think we've converted many governors in Nigeria to epidemiologists. You know, they ask very complex questions. We provide advice, we provide support. We've sent teams to almost every state in the country. So I think by and large, most state governments have really come on board with the response and work together with our teams. And I think one of the lasting legacies of this response will be a much more solid infrastructure, knowledge, expertise on how to manage infectious disease outbreaks at the state level in Nigeria.
And there's this clause in terms of testing. There's this, pressure on the National Reference Laboratory in terms of testing. And there's been concerns that not enough testing is being done, despite the numbers we're recording daily. And isn't, with the increasing number of laboratories, 120 or more across the country, shouldn't the pressure, be reduced from the National Reference Laboratory?
Yeah, so the first thing, you're absolutely right. Colleagues at the National Reference Lab have been working, we have a 3-shift system now, 24 hours every day for the last year. And whether it was Christmas or weekends, they've continued to work and taking a lot of responsibility. The challenge is when you grow this sector in the country, it's not just providing the labs. It's also the human resources. The demand, this work is very intense, so people have to keep doing it every day. So what we saw was, once you set up a lab, in the beginning, in a new state, there's a lot of enthusiasm, but after a while, people see how difficult it is, and then sometimes people get infected themselves, and the level of engagement wanes off. But in some states, if you look at the numbers of tests coming out of Kaduna State, for example, or River State, some states have really taken on this challenge, Gombe State, and said, listen, we will build capacity within our state, we will support this effort, and, work with NCDC to grow the testing capacity. And I think these states that have been more proactive about doing this will reap a benefit from it post-COVID, because this infrastructure is there for them, right? The citizens of this state will benefit from a much improved diagnostic capabilities across the country. I'm excited about the future.
While we're on the issue of testing, you may use this forum to clear these allegations that patients, or rather COVID-19 persons, or persons who are suspected to have COVID-19 will give their samples, but they wait till whatever time before they get the results.
The results,
Some
yes.
even allege that they have to bribe.
So you see, I agree. We haven't been. I'll lay my hands up and say, listen, we haven't always been able to deliver a turnaround time of 48 hours, which is what we promised Nigerians. But I don't want to lay the blame on anyone. It's a complex situation. A lot of this are public health workers at the state level. If you think about a state like Lagos State, for instance, sometimes over the last few months, we've had up to 800 new cases every single day, right? Each of those individuals will need to be contacted, taken into care, their families contacted, tested. So it's a lot of work, and colleagues have been at this for over a year. But we've tried to solve some of these problems through technology. So we have built a platform at NCDC, which is now working in 7 states, where at least if your test result is negative, you get a text message directly to your phone because you don't need more counseling. And then we focus on calling those people that have a positive test result that require further care.
And there's also a clause to what he just said. There's this huge racketeering in terms of testing. I'm sure you're aware of that. What is the NCDC doing to crack them down?
So it's also important to remember that anyone that needs a test for public health reasons or for clinical purposes gets that test free of charge anywhere in Nigeria. Those going to the private labs are those that require testing because they need to travel, right? And they then require a piece of paper to show that your test is negative. And there's been some stories, we've all seen them. So firstly, we've identified some of these labs and blacklisted them, and they've been reported in the press. But we know that's not sufficient in our context. So what we're rolling out this week is a verification platform. So all the results from all the private labs get pulled into this platform. We're activating them in all the labs. We're in the last 2 labs now, so this will be live from Friday. And so the airlines or the foreign embassies or foreign countries, anyone can go into that platform, scan a QR code, or check manually with a number to see if that test result actually came from the lab. So we've done two things. Work with the FCT and the Lagos state government and others to shut down labs where that's been found to be the case. We can't shut down labs. State governments have to do that. But also prevent this by using technology and building a verification platform that we can, you know, regain confidence in the tests coming out of Nigeria.
Well, let's go back to the issue of states and their proactiveness, if you like. There are reports that the NCDC got support from the World Bank, and you had up to about 100 million naira that you doled out to the states to kind of respond to this issue of COVID-19. How far with the issue of accountability in this climes now? You know, these are very germane issues, and is NCDC in the position to ensure that these monies were really used for that's what it was meant for in all the states?
So, you know, one thing we did at the beginning of the outbreak, it was really to look for resources to support our work. And we realized that state governments really needed support at the state level. So thankfully, the World Bank supported us with some funds, and we came to an agreement. All this was worked out with the states themselves through the Secretariat of the Nigeria Governors Forum, and came up with a process of giving every state 100 million naira. But there were very strict accountability processes for those funds. And, you know, the states know this. In fact, one state has had to return some of the funds, having not that it was embezzled, but it was spent on a project that wasn't initially approved for those funds to be spent on. So there's a very strict accountability process for states. And I'm really excited that most states have used these funds to build up their response architecture, which will serve them for many years to come.
Let's go to the issue of vaccines. Tuesday, 22nd of February, there were reports that Senegal has received deliveries of its COVID-19 vaccines. And Wednesday, 23rd February, Ghana is receiving COVID vaccines. When is Nigeria receiving?
So, yeah, the first thing to say, listen, that the fact that we are even talking about vaccines globally is, you know, it's such an exciting prospect for all of us. The first few African countries have received vaccines over the last few days, right? My colleague, Dr. Faisal Shuaib, who leads the National Primary Healthcare Development Agency, is the lead agency, and, you know, I've been speaking to him, we've been working together. He has been doing, you know, I'm not sure he slept a single night for the last few weeks, preparing the country, because, you know, delivering the vaccines and taking pictures at the airport is one thing. Distributing these vaccines to those that need it across our big country is another. So I'm fairly optimistic that we will get to the point of receiving those vaccines over the next few days, literally. And once that happens, I think we will then face the next big challenge of making sure we get them across the country. But I think, Ian, I know that people are celebrating and asking the type of question you just asked, but I think if we look back in a year's time, nobody will remember whether you got the vaccine on the 23rd or the 24th or the 27th. We will be among the first few countries in Africa to have this vaccine, and we're looking forward to making
Before
them
the vaccines come,
available to Nigerians. So.
Believing that we agree with that and we are on the same page of being optimistic, there should be a strategy on how to distribute the vaccine, what age group to start with, apart from, of course, the public health frontline workers and all that. So what is the strategy between NCDC, the primary health agency, and PTF itself?
That there is a strategy. There's more than a strategy, there's a plan. And that plan has been extensively discussed. The NPACD has led on developing this plan. They will receive the vaccine. So I have a lot of confidence in the work they're doing. They report frequently to the Presidential Task Force, of which I'm a member. definitely healthcare workers are our first priority. We need to defend the colleagues on the front lines, and then we'll take it from there. The approach is similar to many other countries in the world. The epidemiology shows that the elderly population are more at risk of having a severe illness, so they will probably prioritize first. But there's a clear plan. Also, we have to look at the distribution of cases in Nigeria. Certain states have a much larger burden of infections than other states, so it's most likely that those states will be given some level of priority. But at the same time, we want some vaccines to get to every state in Nigeria. So there's a very careful balancing act to be found. But you know, they've been working on this, and I'm really confident that they'll be able to do this. Remember, in many of the countries that have had problems in delivering vaccines, and we've seen that on TV, their routine vaccination is so good that they don't rely on campaigns, right? We have had challenges with our routine vaccination in Nigeria. So we've done a lot of vaccination campaigns. Nigerians are used to that, and the MPHCD is used to delivering on it. So, you know, I think very often when the rubber hits the road is when you see the best out of Nigerians, and I'm confident that we'll have a good story to tell.
And South Africa, I'm sure you're aware, recently suspended vaccination because of the 50% efficacy of the Pfizer B1351 strains, you know, which is dominant in the country. What can we learn from that? Because we have that in Nigeria too.
So actually, we haven't found the B1351 strain in Nigeria, which is the dominant strain in Nigeria. We found the B117 strain, which has been found to be circulating in the UK. You know, this whole space, it's very interesting because these viruses mutate all the time. And we have started monitoring those mutations through a process called sequencing. Our capacity is still limited, but we're growing that rapidly. But it's important to recognize the risk, that we have to understand how the viruses change, because if they change sufficiently, it may lead to a lack of a drop in efficacy of the vaccine, like what was seen in South Africa. Thankfully, that strain hasn't been found in Nigeria. We'll keep looking very intensively for it, but it really points to the fact that we can't stop our surveillance activities once we have the vaccine, right? And we have to do both.
And looking at this surveillance you just mentioned, only recently, just a few days ago, NCDC and the Nigerian Institute for Medical Research, you know, did a survey, seroprevalence survey across 4 states, Enugu, Gombe, Nasarawa, and Lagos. What is the survey, the seroprevalence survey, all about?
Okay, so the seroprevalence survey is really to measure the level of antibodies in the population, and what we did was a randomly selected number of people in these 4 states so that our survey results will be representative of the burden of infection in the states where the survey was carried out in. And we saw a prevalence of antibodies to this virus, the SARS-CoV-2 virus. 23% of the surveyed population had it in Enugu and Lagos, about 19% in Nasarawa, and 9% thereabouts in Gombe. You know, the most important conclusion to draw is that even in Lagos, with the amount of infections they've had, 80%, 90%, 80% of the population is still susceptible to this virus. And so it really points to the fact that we have to focus on the vaccination campaign that we mentioned. You see, it's not surprising that we saw a prevalence of close to 20% of the population, because this is a virus in which 80% of those infected have no symptoms, right? And if you don't have symptoms, there's little impetus to go to test. Similar results have been found in many countries. In fact, in a survey in South Africa, 1 in 2 people, blood donors, were found to be have the antibodies to this infection. So it really shows 2 things. There's been a lot more transmission of the virus that we are able to find from our surveillance system, but by no means is it close enough to think that we no longer need the vaccination campaign. We absolutely need to focus on
What does the presence of the antibodies mean? Does it mean that those individuals are not going to be susceptible to the disease? or to the virus? Or does it mean that when they are administered the vaccines, it will not be efficacious?
So if the virus was a stable virus, I would have said yes, that they would now be immune to getting the virus. But because the virus changes so quickly, you might get a virus that has slightly changed from the previous infection. And we have seen reinfections happen already in individuals that were already infected. So it doesn't mean, in this case, that you're immune to the subsequent infection. It also has the same reason why people still need to get vaccines. Vaccines offer a much broader protection than an individual infection to one variant of the virus. So everyone should get ready to get vaccinated.
Still, using your picking up from what you just said earlier, the issue of mutation. To a layman like me, I would say the vaccines have been discovered just some few weeks back, few months back, but the virus is mutated. So what does this mean when it comes to the efficacy of the vaccine with respect to the mutated viruses?
That's actually a very good question, because you're absolutely right in the principle, right? The vaccine is constantly changing, the virus is constantly mutating, and the vaccine is developed against a virus, strain. Absolutely, and if it changes quickly enough, then the vaccine loses. So that's why, absolutely. So theoretically, you're absolutely right. It's a possibility, and it is why we have to continue testing the efficacy of the vaccine, even when we've started immunizing, and making sure that people actually get the protection that they need. So far, globally, the data is very good, right? Some countries, the country that has vaccinated the biggest part of their population is Israel. Yeah, and you can see from the numbers, as vaccine distribution increased, the radical reduction in hospitalization and deaths. In the UK, that has just, I think, about 17 million people have now received at least the first dose in the UK. We've also seen a reduction in cases, and that's talking about reopening the economy.
But in Israel, and it's only in the UK that you have the incidence of mutations. You don't have incidence of mutations in any.
Well, the UK does a lot of sequencing, right? And so you're more likely to find where you're looking for them. But having said that, just to go back to your question, there's definitely that possibility. And so we have to keep aware of that and continue our surveillance and make sure that we focus our efforts on where the virus is. You see, mutations only happen when transmission happens, right? So that's why we're really